And weirdly, I can't see myself, unlike, which is kind of refreshing after staring at video of yourself all day long, but hopefully, let me know if I'm like not actually on the screen or something.
Well, you were there a second ago, but now it's not.
My computer just joined.
Uh-oh. So fun with all our technology. We're really putting Zoom through its paces.
Good afternoon, everyone, and thank you for joining us for another in our series of live stream webinars to help answer questions about the spread of the COVID-19 in our mountain towns and communities. Today, we are going to look at the economic impacts of the outbreak on our mental health and psyche. My name is David Krause, and I'm the editor of the Aspen Times, and I lead a group of editors for Swift Communications, which has publications in California, Utah, and Colorado. We will be hosting this live stream for about the next 45 minutes, and we are pleased to be joined today by Dr. Matt Wong, who is a private practice clinical psychologist in South Lake Tahoe, and Deanna Rhodes, the executive director of Connect for Summit County in Utah out of Park City. We're also trying to get on the line Phebe Bell, the behavioral health director of the Nevada County Department of Health in Grass Valley, California. She's having a little bit of technical issues, so we hope she'll be able to pop on here shortly. We have put together a list, as we have in the past couple of weeks, from the editors of our newsrooms who have been hearing from our readers. And we invite you, our viewers, to send in questions on this feed, and we'll get to those at the last part of our session. If you are joining us via Zoom, I do ask that you hit your mute button now. I'd like to quickly introduce the editors in each of the mountain communities that we serve so you, our viewers, know who your local contacts are. Starting out in California, we have Brian Hamilton at the Sierra Sun and Grass Valley Union, and Bill Rozak at the Tahoe Tribune. In Utah, we have Bubba Brown at the Park Record in Park City. And in Colorado, in addition to myself and Aspen, we have Lisa Schlichtman at the Steamboat Pilot in Today, Nate Peterson at the Vail Daily, Nicole Miller at the Summit Daily News, Peter Bowman at the Glenwood Springs Post-Independent, Eli Pace at the Sky High News serving Grand County, Josh Carney at the Craig Press, Kyle Mills at the Rifle Citizen Telegram. And then as well, we have some of our agricultural magazines and publications include editors Carrie Statham and Mariah Wimmer at the Tri-State Livestock News and Farm Rancher Exchange. And just so our viewers know, after this live stream, we will be posting this Q&A to all of our websites and on social media. So if you missed any of it or you want to share it with any of your friends, we'll have it on our social media sites, Facebook, as well as our homepage shortly after this. With that, I would like to turn over the conversation to Gary Agnew, who is our marketing strategist for Swift Communications. and has been working with our auditors for the past almost month now on this project, as well as to our panelists. So we'll hope to get Phoebe on the line, but we will start with Dr. Matt and Deanna. So Kelly, please feel free to take it away.
Thanks, Dave, and thanks to our panelists for being with us today, and thanks to our attendees. We've got Phoebe, she's trying to get called in. I want to introduce Deanna Rhodes, who's with Connect Summit County. Deanna, you want to introduce yourself really quick?
Absolutely. Thanks so much for having us and just guiding this discussion that's so important right now about mental health and what's going on with COVID-19. So my name is Deanna Rhodes. I'm the Executive Director of Connect Summit County in Utah, and we are a nonprofit. Our mission is to create a well-informed, stigma-free community with access to mental health resources for everyone. And right now, figuring out what that access is quite challenging because it's shifting constantly. And so, we recognize there is a huge need for mental health resources. And so we are just trying as fast as we can to get that information out into the community.
Great, thank you. Thanks for joining us today. And Dr. Matt Wong is a clinical psychologist in South Lake Tahoe, California.
Yep, I appreciate the opportunity to speak on this. I know that there are a lot of folks out there right now who are worried, stressed, overwhelmed, and I hope through our conversation today, I can give some quick, simple tips and maybe some techniques and maybe to spark a little conversation to help people's time with this.
Great, thank you both so much. So we'll dive right into our questions, and please make sure for viewers out there, put your questions into our comments thread so we can get them answered towards the end of the session. So starting off at the top, obviously we're all trying to stay at home right now. Some of us are in states that have shelter-in-place orders. So what are some options for people kind of knowing the limitations we have in the current conditions to access mental health resources?
Absolutely. I'll go first if that's okay.
Go ahead.
So here in Summit County, Utah, Connect Summit County, we have something called a peer navigation line, and it's a person on the other end of the phone. The number for Summit County, Utah is 435-776-HELP, H-E-L-P, and that person is a peer support who can actually guide someone through and try to navigate the system and help them connect with those services. I'm sure a lot of the other communities have things like this as well and directories, but most importantly is most mental health providers have been able to make the transition to telehealth. And so those resources are out there. Another thing that we've done here in Summit County is we've taken our support groups online and to be a virtual offering. And again, I think a lot of people across the country have been able to do that pretty quickly. There's definitely some challenges and some kinks, and it's a different way of doing things, but those resources still exist because we consider those mental health resources still to be very essential.
Perfect. Yeah, Dr. Matt, is that true for you? Are you moving into telehealth and your colleagues are as well?
I have actually been in telehealth for a couple of years now, so the transition for me wasn't quite as drastic as for maybe some other clinicians. Most of my colleagues have transitioned as much as they could. Fortunately, the least impacted service that I provide is individual therapy and counseling. So I have been able to shift over probably about 70% of my caseload to this telehealth platform. Just to give a little bit of a plug here, I noticed that a lot of SWIFT's papers are in mountain towns. And I don't know how familiar you folks are or your readers or listeners are, but Vail Resorts actually has a pretty cool employee assistance program that allows some pretty amazing access to therapists like me. So basically the way it works is if you are either a seasonal or a full-time employee, spouse, child, and the cool thing that I really like about it is even if you're a roommate of somebody who's a Vail employee, you can get access to free mental health services through their employee assistance provider, the name of which is ComPsych. So there are a lot of routes to get access to free therapy, which I think is pretty cool, probably in a lot of the areas that your papers serve.
Absolutely, that's great. Yeah, that would definitely have an impact in quite a lot of our communities. Good to know. So getting into some of the specifics of the scenarios that we're dealing with right now, what are some of the challenges that we're worried about for mental health when it comes to social distancing, self-quarantining, you know, how people kind of maybe feel isolated from their community or maybe their social network.
In my practice, I kind of see it going a couple of different ways. I think the common conversation that we're having is how hard it is to not be able to go out and how we feel distant from our friends. And I certainly do think that that's a huge issue and don't want to minimize it. But I think the part that we don't always talk about is that because we are forced to stay home, sometimes issues within a family are exacerbated because you are with folks who maybe you don't feel totally comfortable with. Sort of a milder version of that, I think that many folks are struggling with right now is the shift of having kids be educated at home and also trying to balance work at the same time. It's probably the top issue that I work with. And, you know, I think that there are some huge disparities in families, and some really are able to bridge that transition, and some are having a hard time. Some kids are more adaptable to changes like that, and some just need transition time and support. And it really shifts the burden from schools, which have trained professionals and oftentimes access to mental health folks as well to help ease these issues. And the burden has sort of been shifted on to parents and families.
Great point. Deanna, anything you'd add to that?
Yeah, I mean, you definitely bring up some really great points. I think for us as a nonprofit and focusing on that stigma, what we notice is that, you know, as our name implies, connect, that's what we really have focused on. And we know that connection is the opposite of addiction, right? And so being able to make these connections, we have to think about how we do them in a different way. A really different way. And so I think, you know, people have been really creative, and that's awesome. I think the one thing we have to keep in mind when we're kind of taking care of ourselves is, you know, check on your strong friends, right? The ones that you think maybe don't need it. Those are probably the ones we need to reach out to because they're not used to reaching out to you. And then also just for your own self, please don't be afraid to jump on a phone call, reach out to someone that you haven't talked to in a long time, and try to make those connections in a virtual manner.
Absolutely. Yeah, it's helpful that we have, you know, technology like Zoom and things like that to maybe leveraging those types of resources to make those connections. So what are some of the tactics that you would recommend? What can people do for their mental health while we're in this very unique situation?
I can jump in again here.
Go for it.
You know, I think that if we look at the parts of our lives that have changed the most, it's the part that provide us with meaning and structure kind of on a daily basis. Whereas people might have gone into a job every single day for, you know, a set number of hours, and they kind of had their rhythm and routine. Transitioning into the home requires a whole different set of structures and I think supports as well. Because of that, I think one of the most important things that people can do is just keep a regular routine. If you set an alarm prior to get to work by a certain time, I think it's a great idea to keep your rhythm, your sleep rhythm intact, and to try to emulate as many parts of your day that you had before as you do now. So if it meant that, you know, maybe you did some paperwork from this time to this time, continue to do things like that. Continue to give yourself breaks, much like you would at a job. And as much of that structure as you can incorporate in your daily tasks, I think it's wonderful. Another little tip I think that is really helpful is to have one goal for every single day. And it doesn't have to be the world's biggest goal, even if it's just, you know, my goal today is to put my socks away, for instance. Something small like that can really help us keep going and to continue to look forward and to feel like we have a little bit of control in a situation that feels like we've lost a bunch.
Those are great tips. And I like the idea that it could be just something small. It doesn't have to be a huge goal for one day, but just to keep you on track. Deanna, anything you'd want to add to those strategies?
Well, and I'd like to actually build on that last piece there. I think really just for myself and for the staff and the team that I'm trying to lead is I really had to recognize that we're really here. It's a huge shift. There's a lot that we're all dealing with, whether it's children being at home or just not having the routine or the office to go to. All of that disruption is that, you know, we kind of have to focus on the essential things. And it's a little bit of a paradigm shift for someone who is typically used to getting it all done. You know, we really have to be a little bit more forgiving of ourselves, and you know, if it's putting away the socks, that has to really be the focus, and not trying to do all the things or catch up on, you know, I see a lot of social media posts that are like, oh, I'm gonna clean out the garage and I'm gonna do all of these things that I've been putting off for literally years. And I think that if that is motivating and that's interesting and that it passes the time for you, that's great and really, really healthy. But don't feel like this is the time that you have to do those projects. I think this is the time to really go within and take care of yourself. And if it's just putting away socks, that is absolutely okay.
Yeah, social media probably can add to that pressure too, right? If you see other people are, you know, doing a lot of projects around the house or baking sourdough bread, you know, you feel like, oh, well, maybe I should be doing that. You know, maybe I need to have bigger goals for myself. So I think forgiveness for yourself is a great recommendation.
And Kelly, that actually brings up a really good point too. We have a lot of good research emerging about social media and about tech platforms in general. And you know, the research isn't super flattering about it. And one of the recommendations I'm making to many of the people that I work with is to turn off your phone, to put it down. Don't go on Facebook. Literally just turn your phone off for a set time in your day to disconnect a little bit from some of these pressures that we might not even, you know, recognize immediately as pressures. And I think that disconnecting as much from that element as we can right now is pretty darn helpful.
Great point. It's hard for us because we're in the news industry, right? And so it's like constant news all the time, and it applies for us just as much as it does for everybody else, for sure, to at least have that time where you take a break.
Absolutely. Yep. And if you are taking a break, maybe that's the time to put the phone down.
Mm-hmm, definitely. So I think one thing we're looking at and we're hoping to do a specific session on in the future is unemployment, financial, economic instability. That's a big thing that is another effect of the current crisis, right? So what are some of maybe specific concerns around those types of issues that might bring up mental health challenges for people?
This is a real tough one. I mean, as a small business owner, I face a lot of the same uncertainty that folks experience. Obviously not exactly the same as everybody, but you know, I think the strategy that I've adopted for myself is to really put a limit on how much I allow myself to engage in the future predicting. You know, I think that it would be nice if we all had a crystal ball, but we certainly don't. And the worst thing to do for, I think, our own sense of anxiety and maybe even well-being is to say, there's this big thing that we don't really understand that could potentially happen in the future, and there isn't really much we can do to change it. That tends to ramp our feelings of worry up quite a bit. And I think a slightly different approach is to say, look, I'm going to take it day by day. I'm going to focus on the things that I can focus on to ensure my economic well-being today. And I'm going to approach tomorrow the same way, trusting that if I do that consistently, day in and day out, eventually I'll be okay.
Great point. Deanna, anything you want to add on to that?
Well, I think what it probably is relevant to bring up is you know, yesterday was April 1st, and that is a really big trigger day for a lot of people based on unemployment and based on the fact that, you know, rent starts to become due, and depending where you are, that's obviously a really big deal. And so I think, you know, just recognizing that is really a big thing. I think also, and this maybe applies more not in a crisis situation, but just in general, whenever someone loses their job, you know, you lost something, you're grieving, right? And I think it's important to let yourself feel those things. And it's really hard when there's all of this additional panic. But I do think it's important to let the process play out as much as you can, and probably look for those resources. You know, again, I think at this moment, because of so many people are experiencing this together, there are a lot of virtual supports popping up, whether it's actually a support group or it's telehealth or, you know, it's a free yoga class online. I think popping up to do those things is probably this is a good time to try to take advantage of that.
Great points. Thank you. So obviously we're in a lot of beautiful places. We're in a lot of places where outdoor activities are very important to us and very much a part of our lifestyle. So how important is it, or, you know, how does spending time outdoors maybe become part of a self-care strategy that you might want to implement during this kind of crisis time?
Yeah, for me, I love going on walks with my dog. And one of the strategies that I've found to both help pass the time a bit, but also I think feel like I have a sense of well-being, is to just go out and throw a stick or a ball with my dog for a little bit. And, you know, I think the outdoors can be wonderfully healing and calming places. In fact, there's quite a bit of research on color and how colors affect our emotions, and colors green and blue actually do seem to have a calming effect on us. So what are the two biggest things that are generally green and blue? Well, you got the sky and trees, or grass, or whatever it is that you have around you. So I think that there is something important about getting outdoors. And, you know, I think the counterpoint to that is also that we have these, here in California at least, orders to stay indoors as much as we can. And, you know, there are public health guidelines to be thoughtful about as well. I know down in the San Francisco Bay Area, they had a big problem a couple of weekends ago because the weather was nice and everybody was flocking to the beach because it was nice and people were sort of bored. And the strategy that I've sort of adopted is to try to go to places where there aren't going to be a whole lot of people, and just try to make it a little bit of a balance point of getting out, but also not being around a whole lot of people.
Sure. Still following those guidelines and staying safe.
Mm-hmm.
Yeah, I think that's a good point. You know, here in Utah, we don't have that mandate to stay indoors. You know, we're definitely encouraged to get out, and we have a lot more, I think, space. You know, we don't have quite as much density, but we definitely have to keep in mind that we can't congregate at trailheads or have big, massive groups, or, you know, for us, go up on the ski resorts and when they're not open and cause potential medical problems that would just add to our system. So that's really, really important to keep in mind. I think one thing I noticed with going outside is that's the one way that I can truly let go of my technology. It's really hard to even go on a walk and like fiddle with my phone. And so it's easier just to leave it behind. And if that's the tool that you use to kind of get off the social media, to Dr. Matt's point earlier of the technology and how challenging that is, I think that's a really good trade-off to be able to kind of focus on.
Great point. A good maybe thing you could pair together is time away from technology and time spent outside.
Mm-hmm. Absolutely.
So getting into maybe a little bit more of the serious side of the issue, what are some ways that people can tell the difference between just this maybe stress that's going along with this type of unique situation that we're in, and something more serious that maybe they need to seek some help or assistance around?
This is honestly a bit of a tough question. You know, I think in an ideal situation, we would all be able to rely on our own resources to check in with ourselves, to say, how am I doing today versus maybe when I'm at my best, or maybe even when I'm just sort of at my average. And that requires quite a bit of self-knowledge. And I think that, you know, to kind of soften the burden on people, I think it's important to listen to what the people in your life are saying to you. If people are noticing that you're easily upset or that you're having a particular hard time, maybe that's a pretty good signal. Another is, do you feel generally that you're able to do the things that you need to do in a day? And if the answer is no, then that also might be a bit of a red flag. You know, we have this model in primary care of a checkup, right? You go in once or twice a year, or maybe you go to your dentist every 6 months for a checkup to make sure that everything is going well. And I think that in terms of mental health, that same kind of a concept is really helpful. You know, I get some people who come to my office who just say, you know, I just want somebody to check in with. And it doesn't end up being a whole bunch of long, laborious sessions. Maybe it's a session or two with a mental health professional just to do a check-in and sort of a check-up. I think that those are pretty good ways of addressing it as well.
Phoebe, are you there? Are you working?
I think so. Can you guys hear me?
There we go. Yeah, we can hear you perfectly. Awesome.
Oh my gosh, I'm so sorry. That was technological meltdown.
You're good. That's what happens. We've been there. You want to jump in on this question at all? Any ideas about how people can look at, standard stress versus maybe getting some additional support?
Yeah, I think Dr. Matt there was covering a lot of the really important stuff, but something we've just really been focusing on is it is such an important time to reach out and to not to bury those feelings of overwhelmed or getting really sad or depressed, that it's a really important time to contact the people you love or care for or who care about you, your friends, your family. If you're not comfortable doing that, if you feel like you might scare them with how you're feeling, then reach out to one of the national numbers that are available or a local hotline. Those resources are really available to us right now, and it's the time to use them. I haven't actually investigated it too much myself, but SAMHSA has a national disaster distress hotline that we've been giving out a lot to people, because the folks answering that call are really trained to handle this kind of anxiety that happens during a disaster, and a pandemic is certainly a disaster in that sense. So just really don't take it lightly. If you really find yourself going to dark places, reach out, ask for some help.
Sure, that's a great point. And maybe some people who maybe in a normal time don't notice those feelings or don't have them as much might need a little bit more of an understanding of where to find resources and how to get help.
Yeah, exactly. I think many of us feel like we have a pretty good strategy for staying well in kind of standard operating times, but these are not those standard times. Everybody's feeling overwhelmed and anxious and alone sometimes. Life is so different right now. And so we may need more than we normally need to support ourselves. And then equally much, I would say to people that did have some kind of mental health care strategy in place prior to things getting a little wild, keep that going. This is not the time to cut off communication with your therapist or stop taking your medications or whatever it might be. Keep your normal strategies in place and just think about adding to them versus subtracting from them right now.
Right. Great point. Deanna, anything you would want to add to those points they made?
Yeah, I would just kind of blend both of them. I really like hearing, it's like a checkup, and also what Phoebe's saying about it's not normal. It's not a normal time. It is. What we do here at Connect Summit County is we do a lot with stigma, and this is everyone. Nobody is okay. It is okay to not be okay. And I think absolutely those resources are out there. They're accessible. I know I mentioned earlier in Summit County, we're doing these virtual support groups. They're free. They're for anyone, whether you have insurance or not. And, I think there are a lot of resources out there in the different communities. And I would just encourage people to get in there, to pop on. If it doesn't work for you, pop right back out. But I would rather see people err on the side of caution than on trying to be, really managing it by themselves. Because even, the question is phrased, tell the difference between stress and something more serious. Well, this is a lot of stress, and stress can be very serious. So I would just encourage people to really, really take charge of their own mental health right now.
Great. How about for the people around you? So maybe, specific things that you should look for if someone in your household, or maybe someone who you don't live with, but you've talked to and you're worried that they're struggling. What are some things to look for if you're part of a support?
To look for or to try to practice?
Maybe both. Maybe, how do you gauge how that person is doing? And then if you think they might need some additional help, what are some steps you could take?
Yeah, I think this is really the time to practice patience and compassion with each other. It's a stressful thing to be stuck at home. It's sometimes stressful for families to be around people, like I said earlier, that they're not fully happy with sometimes. And it's not a great time to go in and try to solve all of the problems at once. I think it's a great time to take a step back and to have a little bit of perspective on, you know, what we can offer and how we as individuals all affect the emotional tone of a household. And I think that practicing that sort of patience or just delaying a conversation, maybe a couple of extra beats, allows us to cool down so that situations don't become difficult for people. And I think one concrete thing that people can to do is take a course in mental health first aid. You know, we have CPR courses, we have first aid courses through the American Red Cross and a bunch of other organizations that are wonderful and teach us how to respond to physical injury if you're the one on the front lines, but maybe you don't have a whole lot of medical training. There's a very similar thing called mental health first aid, and there are online courses that families can take. It's a wonderful thing to take as a family together so that everyone can kind of learn the techniques and to really support instead of tear down.
That's cool. I haven't heard of that before.
It is pretty cool. They're pretty accessible. You know, I've seen them online for as cheap as like 10 or 15 bucks. And they're pre-recorded, and I think they offer a lot of practical, helpful, everyday types of things that people can do.
Phoebe, were you going to jump in?
Yeah, no, I agree. That's a great suggestion. And I really appreciate what you're saying about, there's something about, you know, being cooped up together for much longer stretches of time than you're typically together as a family that sort of reminds you of all those behavior patterns of your loved ones that now are kind of in your face, and our tempers are shorter and our patience is worn thin, and it suddenly feels like the best of times to address that long-standing dynamic with your 20-year-old daughter or whatever, and it's not. It's really not. This is the time for the opposite. It's the time to, like you're saying, have compassion and forgiveness and patience, and try to ride those out, step away. That's a great moment to go for that walk around the block and take that deep breath and turn on that mindfulness app that you just downloaded, and all those kinds of things. But on the flip side, I think your question also is getting at when things get worse for that person, how do you notice that and how do you reach out to them? And I think it's the same signals that you look for in yourself when behavior really starts to change. People are really withdrawing, they're not engaging anymore, their sleep patterns change, their eating patterns change. Those can be signs that depression is setting in a more serious way, and they're not able to kind of engage in regular life in the way that they normally are able to. And those can be signs, you know, at an initial stage where you're really hand-holding and encouraging, like, hey, come on, I want to go for a walk, and I think it'd be really great for you to get outside for 20 minutes. Let's go together. I'd love to go with you. Let's talk, let's connect. To not take those pushing aways as too seriously. At some point you have to push past that pushing away mechanism and engage that person and start to ask some hard questions about what are they really thinking about, how are they feeling. If you get worried enough, asking the hard questions like, have you thought about ending your life? Are you considering suicide right now? You really need to say those words if you're really worried about somebody, and I think that's incredibly important to say.
Absolutely. Deanna, any other points you want to add to what they brought up?
You know, I think Phoebe made the point right there at the end. There's another training on that you can go through called Question, Persuade, Refer, and it's QPR, like CPR, and it's very specific about suicide and suicide prevention. And I think Phoebe said it, you have to ask the hard question, and it's really hard, even in practice, to actually ask those questions. But, you know, if you see that person in your life, you will not regret asking that question, no matter what. You will be glad you asked it. So I just encourage people to be bold.
Yeah, absolutely. All right, Dave, you got some questions put together you want to ask our panelists?
I sure do. Thank you, Kelly, and thank you, Deanna, Dr. Matt, and Phoebe for joining us. I've got a few reader questions. One I'll get to, I think you kind of might have touched on it in that last answer, but certainly another one to circle back on. From a reader in Glenwood Springs, should we all adjust our interpersonal expectations we have of each other, our friends, our family, our coworkers, during this time, given that the normal doesn't exist for anyone right now? So maybe that idea of what the normal is and how do we come out on the other side, but what about our interpersonal expectations?
I think this is going to be different for every single person. I have a neighbor who is a computer programmer. He works from home 99% of the time, and he doesn't notice any difference in his life at all right now. Versus people who are going out multiple times a week and doing get-togethers, it's going to be a bit of a bigger transition. And I think that we all need to ask ourselves, what is it that we need to thrive in our social circles? If you can, obviously replace things with a phone call or something like this Zoom call. I think those are valuable tools. But I think that for many of us, it probably is going to require us to readjust our norms to come up with something, hopefully, as Deanna talks about, where we can still feel connected to each other. And I do think it is quite possible. I think that we all, again, need to be a bit patient with it and to allow people to figure it out and to, as Phoebe was talking about, to not be afraid to reach out when you do need some support. Even if it's from a friend or a parent or whoever.
Something I've been really conscious of is how anxiety plays out for different people, and to practice tolerance of that, because as we've all been discussing, anxiety is everywhere right now. I don't typically run super anxious, and I'm waking up with my mind racing, and I'm definitely feeling more anxious than I typically feel. And I know most other people are as well. And for some people, some of my friends, that anxiety plays out on the sickness side, and they're terrified of getting sick, and they're, obsessed with germs and whatnot. For myself, I get anxious about the economic situation. I check my bank balance more than I normally would. I think about, well, what if and what if? And so as I look at the behaviors of the people around me, just noticing the behaviors that are maybe most annoying right now or difficult to be around probably are stemming from that anxiety, and trying to see where that behavior is coming from is giving me a greater capacity for patience and tolerance of that behavior. And I think that's a moment of grace we should all offer each other right now, is how we're expressing this time is different person to person, and can be challenging at times, but know where it's coming from. Understanding where it's coming from can help us be kinder to it.
Let me ask a follow-up on that, Phoebe, because you mentioned it yourself, and maybe all three of you panelists could give us, what is your best personal tip when you get anxious and when you have that anxiety and you wake up in the morning and your head is racing? Is it 3 breaths and sit back, or maybe each of you could give us your best practice for trying to calm down your brain a little bit? Why don't you go first, Phoebe, since you got that ball rolling?
For me personally, I like to start my day with some kind of exercise, and it's been a little challenging in the snow and whatnot and with social distancing, but even still, getting out for a quick run in the morning does so much to just clear my head and take the edge off, and kind of reconnect me to nature and allow me to sort of face the day a little bit better than I might otherwise have. So that's been key for me.
Deanna, what about you?
For me, I think I like everyone, I have so many thoughts that are going through my head. So for me, I just like to try to write it all down and just dump it on a piece of paper. And that usually helps quite a bit, and I can write as long as I need to.
I love that. That's my go-to. Get it out of your brain, right?
Right.
What about you, Dr. Matt?
Well, I wake up, I pick up my cat and give him some kitty snuggles, and that usually sets me in a pretty good direction for the day. And from there, I tend to be pretty physically active too. So a bike ride or a nice stretch with some music in the morning, boy, that really helps me set my day on a good path.
So it sounds like if you get ahead of it at the beginning of the day, that it'll help set the tone versus waking up and being scattershot and trying to get it down. But if it's exercising or kitty snuggles or writing it down, right? It's just like use the first part of the day to kind of help set your tone. Is that kind of what you guys feel?
It works for me. I'm a morning person. If I could have it my way, I would start working at 5 o'clock in the morning and be done by 10 or 11, but I realize it's not how everybody works. I think the goal is to find a routine that works for you. And if it happens to be in the morning like it is for me, then fantastic. But I know that there are a lot of night owls out there, and I don't understand them, but I know that they're out there. And I think that if you can incorporate some practice for yourself at some point throughout the day that's consistent and it's routine, and it brings you just kind of a simple joy and maybe even some physical activity, I think you've got a lot of the keys to success with that.
Great. That was a little bit of a tangent. That was my own personal question, but it's interesting to see how people who we take advice from, what their best practices are, because they're like, oh, they have a good idea on that. So thank you for musing me on that. Next reader question. And I think this is, a lot of us are seeing this, especially in our communities where the pandemic is really snowballed, right? You know, in a week, it's, you know, 1 death, or now it's 5, or the amount of positive cases. But the question is, how do you deal with people who, for whatever reason, want to act normal and show little to no compassion about the situation? Phoebe, you want to jump on that?
No, it's a hard one.
Yeah.
I think we probably all have some of these people in our lives, and it's really challenging to try to engage. And I think a little bit it's meeting each person where they're at, like trying to understand where they're coming from with that approach. So for some people, it's fact dialogue. And so, you know, where are you getting your information? Can I share some other sources with you, like the CDC or the World Health Organization, or some more reputable sources, and try and connect that way. For some people, it's emotional. It's fear and denial and anxiety playing out in a different way. And so trying to find a different avenue in, trying to connect, make it personal at some level, like who are the loved ones in your life that you would be sad, who are vulnerable in some way, and you would certainly be sad and scared if they got sick, and how can we help keep them safe? I don't know. I don't think I have great answers on it. It's trying different strategies with different people.
Matt, what's your approach to something like this when you have somebody who wants to act normal and consider it's a bigger thing that people are making, or it's not as big of a thing as people are making it out?
I don't think you can make that the brunt of the conversation. I think if you lead with something that is confronting to people, their tendency is to turn you off and to ignore everything that you got to say. And I think that the only way that I've been able to find, you know, again, I'm going to go back to Deanna's point about this, about connection. If you can find a point of commonality with somebody who maybe you disagree with, you can turn something that feels incredibly frustrating into a bit of a mental challenge that can keep you engaged. Okay, maybe they're not going to see this issue the same way that you do. Is there some opening for a conversation where you can build a connection so that maybe in an hour, maybe in 2 hours, maybe 2 days from now, you can say, hey, you know, I've really been thinking about this thing. What are your thoughts about this possibility? Instead of coming at them from the perspective that they're wrong, they need to change their behaviors right away, they're endangering people, because that tends to shut down conversations. Whereas if you ask questions or just gently lead into a conversation, you have a much higher chance of success of getting them to consider a different perspective.
Yeah, I would just offer, you know, in any situation, not just in a crisis and in a pandemic, but the only thing that you can really control in this entire world is your reactions. And so I think, I personally, right, like I had an experience where I was very upset about the way people were acting, and I realized I can't do anything about that. You know, whatever my judgment was. And so I just had to really like actually look at that and say, oh, okay, that's how I feel. And then just turn my back on it, walk away. And this was more of a public group, so I was able to do that. But I think depending on who this person is in this environment, I think there's a point where you have to say, I can only control what I think or how I react and what I do. And I don't get to control what that person believes and thinks.
Great, thank you. Maybe a couple more and we'll wrap it up. Dr. Matt, I think this is coming off of what you said toward the beginning of the session. Is there a best practice or a schedule that we should try to follow when we have our kids at home and we're still trying to get our work done and all the other stressors that come along with disruption in our lives? But I guess more specifically, that schedule for children and how do you make all that work?
Yep. I think that as best as you can emulate the classroom, the transition is just going to be that much easier. You know, one technique that a lot of teachers use is they list out the schedule on the whiteboard first thing in the morning. So the kids sit down and the teacher kind of runs over the plan throughout the day. I think that's a pretty helpful tip for parents. For parents who are dealing with kids who maybe aren't receptive or are having a hard time with the transition, what I've been recommending is that they front load their efforts in the morning. So if that means waking up 10, 15, 20 minutes earlier to connect with your kid, to play a game, to gently introduce the idea of homework or school, or maybe even to have a conversation about their feelings of this change, that tends to reduce the problematic behaviors later in the day. Because what I generally see is that kids are feeling pretty overwhelmed, and kids don't have the same vocabulary that us adults have, and they act out their feelings through their behavior. And unfortunately, that often comes at the detriment of parents' work or their ability to focus on something without a kid crying or screaming or coming and annoying them. So my strongest recommendation is to front load it and to spend some time in the morning bonding, connecting, talking about feelings, talking about the structure of the day, and also pairing it with a couple of visual reminders. And also realizing that the transitions throughout the day are going to be real important to do very similar things. So maybe a kid is going to have lunchtime. That's a great opportunity to take your lunch to and connect if you aren't already. And then to talk again about the plan for the afternoon.
Great. Last one, maybe Phoebe and Deanna, if you guys have some thoughts on this, kind of in the same vein, people with all of us now working from home, people who are working, and this is kind of a longer question, so I'm going to try to get it pared down, but I have a boss who seems to have disassociation disorder, is that what it's called? Giving me tasks to do that aren't really achievable given this situation that we're in. So what is, it's raising this person's frustration level. Then I get reprimanded for not completing the task. This has been extremely frustrating, of course, for me. What's my best course of action in having a conversation with either my boss or my coworkers about the situation we're in and expectations?
I'll take a stab at that first. As someone who has a team who earlier this morning had a team call and kind of talked through this a little bit is, if you're managing up, right, like how else would you normally manage a situation like this? And normally I think what you would say is, I have these 3 priorities. These are the things I think I'm supposed to do today. What do you think I should be doing instead? And then I just acknowledge, like, I have X time to do this, or whatever that looks like, but I have this is what I can do. And, if you want me to do that other thing, then what would you recommend I take off my plate? I think it's a very similar type of situation. And I think trying to be open and honest, I would also say, just from somebody who's trying to manage other people and not be that, but yet sometimes probably makes mistakes, is they're under a lot of pressure too, right? Like, their life has changed in a really dramatic way as well. And they probably have all sorts of stressors and conversations that are happening that they might not want to put on your shoulders. And so just kind of giving a little bit of grace there, I think also can be helpful, just in general. So.
Thank you. Phoebe, you want to bring it home?
I don't know about that, but to piggyback on that a tiny bit, I think it's also remaining conscious of your own lack of patience and likelihood of being shorter tempered than you might normally be and less tolerant than you might normally be. So your boss asking you to do 7 different things at the same time on a normal day, you might be able to be like, laugh it off, or yeah, I'll handle that later. And today it might feel like, that's the straw that broke the camel's back. And so acknowledging to yourself that your capacity to handle stress at work on top of all the other stress might be less than it normally is. And so checking in with yourself before you even start that dialogue to say, is this really more about me or more about the situation? And the part that's about me, I need to own and take care of before I approach that conversation. And then calmly, hopefully, be able to do some of the things that Deanna was suggesting around how to communicate clearly and calmly what your concerns are.
Right. Yeah, it is a stressful time, at all of our properties and newspapers. We're all working remotely and Zooming, and to the point you had earlier, you can get frustrated even trying to get on Zoom sometimes, right?
Totally.
And it's just like kind of bringing it back down. But I think we're going to go ahead and end it on that note. Gosh, we've talked and we could keep going on, but I really want to thank everyone for joining us, both on our live stream and here in the session. I want to thank Dr. Matt and Phoebe and Deanna for taking the time out of their busy day to help us understand this and how we can really stay mentally sharp and connect with our friends and families and keep those relationships strong. Also, you saw Kelly had earlier the national numbers, but we really strongly ask and encourage you to reach out to your local agencies and nonprofits that serve your areas. We're all in a lot of mountain towns, so we know that there is help in every community. And I believe it was Phoebe or Deanna said earlier, just don't hesitate, don't feel ashamed or anything, just reach out, even if it's 1 or 2 questions. We really encourage that. We do want to remind you, or I want to remind you, that we'll have this video available as soon as we finish up. We'll get it back up on our websites for replay with all of our local newspapers, websites, for you to watch and to share with your friends. And you can also reach out to our editors if you have follow-up questions, and we can try to help you get those answered. So again, I thank our panel so very much for taking time out of this day, to all of our viewers as well. I'm David Krause, editor of the Aspen Times, along with Kelly Geary-Agnew from Swift Communications. We thank you for joining us today. Next Thursday, we will take a look at personal finance as part of our web series that we've been doing every Thursday. So we'll send out information on that. In the meantime, please stay safe and stay healthy, and talk to each other and talk to your friends. Take care.
Thank you.
Thanks, everybody. Take care.